Go ahead.
Good afternoon, everyone. Today we shall be discussing how possibly we can improve the success rates of IUI. So we all know that for pregnancy to happen, four things need to be fulfilled. One is that the egg should get released. When the egg is getting released, the uterus lining should be perfectly made, and when the tube is picking up the egg, it should be having live sperms in the tube, and the tube should be open, as well as the uterus should be good enough to support the coming embryo. So, in basic four essential things which should happen for any pregnancy to start successfully. సో విల్ రిపీట్ వన్స్ మోర్. నెల నెల ఎగ్ కరెక్ట్గా రిలీజ్ అవ్వాలి. ఎగ్ రిలీజ్ అవ్వడాన్ని మనం ఓవులేషన్ అంటుంటాం. సో ఓవులేషన్ అయ్యే టైంలో గర్భసంచి పొర ఎండోమెట్రియం థిక్నెస్ ఏదైతే ఉందో అది మినిమం మనకి ఎంత ఉండాలో అంత ఉండాలి. సో బేసిక్లీ వీ లైక్ టు హ్యావ్ ద ఎండోమెట్రియం అట్లీస్ట్ 8 mm. 8 mm మందం పొర ఉండాలి. ట్యూబ్స్ ఓపెన్ ఉండాలి. ట్యూబ్స్ ఓపెన్ ఉంటేనే స్పర్మ్ ఎగ్ ట్యూబ్లో కలుస్తాయి. అక్కడే ఫర్టిలైజేషన్ అంటే ఫలదీకరణ అక్కడే అవుతుంది. అండ్ ఫలదీకరణ అయిన తర్వాత ఈ ఎగ్ ఫర్టిలైజ్డ్ ఎగ్ ఏదైతే ఉంటుందో అది యూట్రస్కి నెక్స్ట్ 5th 6th డేకి వచ్చి అక్కడ అతుక్కుంటుంది. సో ఇది న్యాచురల్గా ఫర్టిలైజేషన్ అవ్వాలంటే ఇది బేసిక్ స్టెప్స్. సో ఐయుఐలో మనం ఏం చేస్తున్నాము అంటే ఓవ్యులేషన్ అవుతున్నదా లేదా అని ఫస్ట్ మనం కన్ఫర్మ్ చేస్తాము. ఓవ్యులేషన్ అయ్యే టైంలో యూట్రస్ పొర బాగున్నదా లేదా అని చూసుకుంటాము. ఈ టైంలో గర్భసంచి లోపలికి మనం ప్రాసెస్డ్ సిమెన్ మంచి స్పర్మ్స్ మోటైల్ స్పర్మ్స్ అన్నిటిని కాన్సన్ట్రేట్ చేసి యూట్రస్ లోపల మనం వదులుతున్నాం అనమాట. అంటే ఒక స్టెప్ బైపాస్ చేస్తున్నాం. సో నార్మల్లీ కపుల్ when they are making the semen is let out into the vagina. ఈ వెజానాలో లెట్ అవుట్ చేసినప్పుడు మిలియన్స్ ఆఫ్ స్పర్మ్స్ ఆర్ లెట్ అవుట్ ఇన్ ద సిమెన్. అయితే అది సర్విక్స్ క్రాస్ చేసుకుని యూట్రస్ లోకి వచ్చి యూట్రస్ నుంచి ట్యూబ్స్ లోకి వెళ్ళేసరికి మిలియన్స్ నుంచి థౌసండ్స్ నుంచి లెస్ దెన్ 100 విల్ రీచ్ ద ట్యూబ్ అన్నమాట. సో ఇట్ ఇస్ ఆల్ ఎ నంబర్ గేమ్ హియర్. ఐయుఐలో మనం ఏం చేస్తున్నామంటే వీఆర్ ఎన్ష్యూరింగ్ దాట్ బెస్ట్ మోటైల్ స్పర్మ్స్ ఆర్ కాన్సన్ట్రేటెడ్. మోటైల్ స్పర్మ్స్ మనం అన్ని సెపరేట్ చేసి త్రూ స్పెషల్ టెక్నిక్ ఇన్ ద ల్యాబ్, ఐవీఎఫ్ ల్యాబ్లో మనకు ఆండ్రాలజీ ల్యాబ్లో ఈ సిమెన్ని ప్రాసెస్ చేసి అందులో ఉన్న మోటైల్ స్పర్మ్స్ అన్నిటిని మనం కాన్సన్ట్రేట్ చేసి అది మనము డైరెక్ట్గా యూట్రస్ సర్వీస్ని బైపాస్ చేసి యూట్రస్ లోపల వదులుతున్నాం. సో ఇట్ ఈస్ ఆల్ ఎన్ష్యూరింగ్ good numbers at the right time and to make the timing perfect anamata with the ovulation. So IUI is all about increasing the number of sperms at the required site anamata. So tube loki elaga man veyalem kabatti uterus varku vesesi వదిలేస్తున్నాం అన్నమాట. ఇట్ ఈస్ వెరీ ఈజీ ప్రొసీజర్. ఓపీ ప్రొసీజర్ కింద అయిపోతుంది. చాలా ఈజీగా అయ్యే ప్రొసీజర్. ఇందులో పెయిన్ కానీ ఎట్లాంటి ఇబ్బంది లేడీకి కానీ కలగదు. అండర్ సోనోగ్రఫీ గైడెన్స్ ప్రిఫరబ్లీ చేస్తూ ఉంటాం అన్నమాట. సో దిస్ ఈజ్ అబౌట్ ఐయుఐ. సో ఐయుఐ ఎవరికి పనిచేయదు, ఎవరికి పనిచేస్తుంది, ఇది మనకి అర్థమైతే మనం సక్సెస్ రేట్స్ ఎట్లా పెంచుకోవాలి అనేది వీ కెన్ థింక్ అబౌట్ దాట్ అనమాట. సో ఈ ప్రక్రియలో మనకి ఒక క్లారిటీ అయితే వచ్చింది, ఎగ్ స్పర్మ్ అయితే ట్యూబ్లోనే కలవాలి. సో మనకి ఫర్టిలైజేషన్ ఎట్లా అవుతున్నది, ఫర్టిలైజేషన్ అయిన తర్వాత ఇంప్లాంటేషన్ యూట్రస్ లో అయ్యేది, ఈ రెండు మెయిన్ ఈవెంట్స్ మీద వీ డోంట్ హ్యావ్ ఎనీ కంట్రోల్. సో వేర్ వీ కమ్ ఇన్ టు పిక్చర్ అంటే మనకి ఓవ్యులేషన్ కరెక్ట్ గా అవుతున్నదా లేదా, ఓవ్యులేషన్ టైంలో యూట్రస్ లైనింగ్ బాగున్నదా లేదా, అందులో ఏమి వేరే మనకి ఆటంకం కలిగించే ప్రాబ్లమ్స్ ఏమి లేవు కదా అని చూసుకుంటాము. ఆ టైంలో మనం ఇనఫ్ నంబర్ ఆఫ్ స్పర్మ్స్ యూట్రస్ లో వదులుతున్నాం అనమాట. సో దట్ ఈస్ వై న్యాచురల్ గా ట్రై చేసినప్పుడు మనకి త్రూ ఎగ్ రిలీజ్ అవ్వడానికి వాడే మందులు, ఓవులేషన్ ఇండక్షన్ కి మనం వాడే మెడిసిన్స్ ద్వారా, లేదా న్యాచురల్లీ ట్రై చేసినప్పుడు మనకి పాజిటివ్ ప్రెగ్నెన్సీ రేట్స్ 10% అయితే ఐయుఐలో మనకి ఈ బీయింగ్ ఎట్ ద రైట్ ప్లేస్ అండ్ ద రైట్ నంబర్స్ ఇట్లా ఎన్ష్యూర్ చేస్తే మనకి పర్సంటేజ్ 15 to 20% వరకు పెంచచ్చు. ఇందులో కూడా ఏజ్ ప్లేస్ అ వెరీ ఇంపార్టెంట్ రోల్. సో యంగ్ లేడీస్ లెస్ దెన్ 35 years వీళ్ళకి సక్సెస్ రేట్ విల్ బి మోర్ కంపేర్డ్ టు ద ఓల్డర్ women. So this we cannot change. So age paranga younger ladies will be having a better results than the older ladies. So ఇది కాకుండా can we in any way improve the success rates of IUI అంటే definitely we can try bettering the ovulation and bettering the semen numbers and semen parameters, semen numbers అనుకోండి, motility అనుకోండి. So here comes the role of the couple in improving their IUI chances. ఎట్లా చేస్తారు అని అంటే మినిమం నంబర్స్ అయితే మనకి కావాలి, బికాస్ వన్స్ ద numbers they fall very less. సో మనం అప్పుడు ఐయుఐ చేయలేము. అట్లీస్ట్ మనకి 10 million per ml ఈస్ ద లీస్ట్ కట్ ఆఫ్ అని చెప్పచ్చు, దాంట్లో ఎక్కువే ఉండాలి. అండ్ మోటిలిటీ కూడా కదిలే కణాలు ప్రోగ్రెసివ్ మోటిలిటీ అంటాం, అంటే ఒక పాయింట్ ఏ నుంచి పాయింట్ బికి ముందుకు వెళ్ళే మోటిలిటీ ఏదైతే ఉంటుందో అది కూడా అట్లీస్ట్ మనకి 30% ఉండాలి. అండ్ నార్మల్ లుకింగ్ స్పర్మ్స్ అట్లీస్ట్ 3% అయినా ఉండాలి. సో దిస్ ఇస్ ద బేసిక్ రిక్వైర్మెంట్ ఫర్ అన్ ఐయుఐ. సో ఈ ఇంతకంటే నంబర్స్ తక్కువ అయిపోతే we cannot ensure enough numbers inside the uterus అనమాట, మనకి IUI chances will drastically fall. సో నంబర్స్ పెరగడానికి general health of the male partner has to be looked at and taken care of. So how do we do about it అంటే దీనికి జనరల్ హెల్త్ అంటే మనకి హార్ట్ కి సంబంధించిన హెల్త్ వేరే అనో, లేదా డయాబెటీస్ కి వేరే అనో, హైపర్ టెన్షన్ కి వేరే అనో, ఫర్టిలిటీ ఇష్యూస్ కి వేరే అనో ఉంటుంది. ఓవరాల్ హెల్త్ ఆఫ్ దట్ పర్సన్ హ్యాస్ టు బి ఇంప్రూవ్డ్. ఓవర్ వెయిట్ ఉన్నారనుకోండి, యూ హ్యావ్ టు బ్రింగ్ ద వెయిట్ టువర్డ్స్ ద నార్మల్ ఇది అనమాట. సో డ్రాస్టిక్లీ ఓవర్ నైట్ అయితే ఇది మనం అడ్రస్ చేయలేము, బట్ ట్రై టు లివ్ టువర్డ్స్ అ మోర్ హెల్దియర్ గోల్స్ అనమాట. సో కీపింగ్ ద వెయిట్ as near possible towards the healthier post అనమాట. So BMI you should aim to have a BMI at around 25, 29 and above మనకి obesity అని మనం క్లాసిఫై చేస్తాము. 25.9 నుంచి 29 వరకు మనము ఓవర్ వెయిట్ అని క్లాసిఫై చేస్తాము. అండ్ మోర్ దెన్ 35 BMI అంటే it is morbidly obese అంటాము. So all health complications will start pitching in when the BMI starts 35. So fertility treatments కి ఎప్పుడైనా మనం ప్లాన్ చేసినప్పుడు whatever be the treatment plan, try to keep the goal of maintaining the BMI below 35. 35 కంటే above అయితే we should not offer treatments. So but the ideal would be 25.9. అట్లీస్ట్ 29 కి దగ్గరలో ఉంటే మనకి రెస్పాన్స్ విల్ బి బెటర్, బికాస్ ఎవ్రీ ఇంక్రీజ్ ఇన్ ద 1 degree increase in the BMI, it affects the quality of the sperms. Numbers motility వరకు బాగానే ఉండొచ్చు, మన క్వాలిటీ వైజ్ చూస్తే it definitely affects the quality of the sperm అన్నమాట. So aim to get to the healthier BMI range అన్నమాట. So it as I told you, it has to be a continuous thing. Even if you have reached your goal also, you should aim to maintain it for lifetime. అంటే ప్రెగ్నెన్సీ వాళ్ళు వచ్చేసింది రేపు I can be as I wanted, it doesn't hold like that. Quality of life has to be maintained. So BMI should be towards a more healthier side అన్నమాట. Similarly, how do we do it? అంటే క్రాష్ డైటింగ్ కానీ heavy high intensity workouts, ఇట్లాంటివి these are all big no. So aim for a gradual decrease in the weight and slow, which is more gentle on your body, go for such type of exercise. Basically, you need to maintain some calorie deficit, which can be easily attained by doing simple exercises, also cycling or some aerobic exercises, milder versions, and stretching exercises. Along with these, also try for some deep breathing exercises or yoga and pranayam. Basically, these have a calming effect on your nervous system, and they activate the restorative activities in the body and matter. So reparative work, restoration is something. These all things are speeded up whenever you are doing um, mindfulness, practicing mindfulness or deep breathing exercises, and the pranayam and simple home chanting, at least 15 to 20 minutes per day. Just as the software people, they reboot their systems every now and then, the same way on a regular daily basis, we need to take the body to a restorative mode wherein all small defects can be looked into and rectified. So, uh, work your way towards health in a more gentler way and be nice to your body. So strictly high intensity workouts are a big no. Crash diets are also a big. So incorporate more of nutrient-dense food items in your plate. So all the colorful vegetables, fruits, you should be having more servings of green leafy vegetables, seasonal fruits, seasonal vegetables. At least fruits you should be consuming at least 2 times and a serve of at least 100 to 125 grams for each serve. Similarly, very high dense carbohydrate diet should be avoided. Calorie dense sugars, sweets, these should be cut down. And and especially for the men, please don't keep your laptops on your lap and mobiles also in your pant pockets. The idea is to ensure that the testis, the scrotal temperature should be maintained at least 2 degrees less than the core body temperature. That is why they are kept outside the body, they hang outside the body. So when you are keeping your laptops or your this thing, mobiles in your lap, the temperature, local temperature increases, and the idea of keeping them outside hanging down is lost. Similarly, sitting in a prolonged for prolonged hours, keeping your thighs approximated also increases the local temperature and it affects the quality of the sperms. So, prolonged sitting, prolonged driving, excessive local heat should be avoided. Don't keep your laptops on the laps. Don't keep your mobiles on in your pant pockets. Don't be wearing uh, very tight inner wear and very thick clothes, pants, because this will affect the local ventilation. So keep loose, airy clothing. So avoid the excessive steam baths or hot water baths. And once you get your semen analysis done, if any small um, issues are there with the count or the mobility or the way they are looking, kindly take the help of your andrologist. Just get your scrotal Doppler's ultrasound also done if required or as suggested by your andrologist to just check whether there is any varicocele are there, because these are also contribute to the impaired quality of the semen. So any of these things, if they are there, so kindly get them rectified and try to improve the quality of the semen parameters by taking the prescribed medicines, which include even antioxidants and so on. So these things, as I have told, uh, they don't. These changes cannot be done overnight, and the benefits of changing the lifestyle or taking using these medicines also may not reflect immediately in the semen parameter. So usually they take time. So here you need to have a bit of patience, but slowly and gradually, surely you can work towards better, healthy tomorrow. So this is for the male partner. And second thing is that to ensure good quality, to reduce the stress also, we suggest alternate day sexual intercourse. And many of the partners, they presume that once we have planned IUI for these patients, they don't need to have natural intercourse. That is not correct, because only when the couple is meeting, say on every alternate days. In fact, these days we also suggest to have daily intercourse, because this ensures that the fresh semen is produced and the stress on the sperm is reduced. We get a better quality sperms. So alternate days intercourse, at least when the sperm, the follicle has crossed 12 millimeter, and daily intercourse once the 17 follicle is reached is what we suggest these days. But if it is stressful to plan your events like this, at the least you can be together every on alternate days, or at least 3 times in a week. That also holds good. But please, thinking that IUI has been planned and you don't need to do anything till and just your duty ends with giving a sample for the IUI, that's a big no. So this is how we can improve the quality of the semen. Also, when sometimes when the numbers are on the lesser side, maybe we can try and combine 2 samples. So for that, you can give one sample for freezing on you plan it of the 2 or 3 days of abstinence. You give one sample, we can freeze it, and if on the day of IUI, if the fresh sample is less on numbers or in motility, maybe we can use combining both the fresh and the frozen samples and try to increase the numbers. This is also another way of working around the numbers when they are less. Uh, though the fresh sample is always better than the frozen sample, uh, but if the couple is reluctant to go to further treatments, or when no other better alternative is there, at least we can plan mixing a fresh and the frozen sample and try to get the correct numbers. So for the lady, um, so we know that the treatment it starts from the second day of period. So who all are these patients who require IUI? Let us first revise that also. So as I have told you, the basic um, the problem of fertilization and implantation cannot be addressed in IUI. So IUI goes just as far as ensuring the correct numbers at the correct place and the correct time. So only when milder uh, problems of the male in this thing, like only the numbers are little less but not very less. The motility is little less but not very much. Only in the milder versions we can help out with IUI. Similarly, for the women who are having problems with ovulation, those who are not having regular cycles, those who are having PCOS, uh, these are those who are having endometriosis. They may be having regular cycles, but sometimes there may be issue with ovulation. Ovulation may be happening, but the follicle doesn't rupture and the egg may get trapped inside the follicle, what we call as a luteinized unruptured follicle, which is seen at a greater this thing in endometriosis. So subtle fine tuning of ovulatory dysfunctions can be corrected with medicines which help in growing the follicle to the correct size, and we also help in the ovulation process. So these things require the lady to come to the clinic on day 2, wherein we do a transvaginal scan and we prescribe the required medicines. Initially, maybe we may just give oral medicines, but sometimes, if required, we may give injections also, depending on the case. So, endometriosis or unexplained infertility, where they may be having regular cycles, but obviously some fine tuning may be required there. So, in such cases, we may go for sometimes injections also, either initially or maybe as add-on. Similarly, in the cases of PCOS, those who are not responding to oral medicines, they also may require some injectables. So it varies from person to person. There is no one treatment which fits for everyone. Even for the same lady, she may respond in a different way this cycle, and the next cycle it may be happening in a different way. So on the second day of or third day of the period, we do a scan, and once we see that yes, we can now stimulate her, we start with the medicines, and then we start tracking the growth of the follicle from day 7, 8, or 9, depending, as I have told you, her past history, medical history, how she has taken the earlier treatments and all. Sometimes we can call as early as 5th or 6th day as well. So once we start tracking the follicular size, which requires serial scans. So serial ultrasound scans, for this you need to come to the clinic, and then once the follicle is growing and it is reaching 17 millimeter size, this is the size after which we presume that ovulation can happen on any day. So since after ovulation the egg doesn't hold good inside the body for more than 24 to 30 hours, we ask for daily scans so that we don't miss ovulation, and the IUI is planned on the day of ovulation. So if a spontaneous ovulation is not happening by day 12 to day 14, and the lining is also ready, then we may assist her with ovulation by giving her HCG injections or Ovitril or other agonist injections, or whatever is required. So after giving the trigger injection for ovulation, we usually plan IUI anytime 30 to 40 hours after the trigger injection. So again, we have some ladies, they can ovulate as early as the very next day of trigger injection. Some ladies ovulate spontaneously. Some may not ovulate even 36 to 40 hours even after taking the trigger injection. So again, there is a personal difference, variations are there uh, in each person, and even in every cycle is a different story. So it is sometimes very tiresome, sometimes, especially those with anovulator cycle, PCOS, where we do not, where the follicles grow unpredictably and there is a delay in the growth. So you may need to come more times, but please don't miss your scans, especially once the follicle reaches 17 mm, as you don't want to miss the day of ovulation. And strongly, we suggest that after the follicle reaches 14 mm size, at least try to be together, have regular intercourse every alternate days. And on the after the follicle reaches 17 mm, we strongly suggest daily scans so that we don't miss the day of ovulation. So this would be my tip. I won't say it is a tip because it is a basic requirement also, that once the follicular scan starts and the follicle starts crossing 14 millimeter, please be together every alternate days, and don't miss your scans after the follicle reaches 17 mm. So the all the other things which we have discussed for the man also hold good for the lady, as in keeping the weight towards a more healthier option. The BMI should not cross 35 when you're planning for beauty treatments. You should keep BMI well within 25.9. Please, at least don't try to be in the obese category. Keep your BMI towards less than 29, at least in the overweight. Don't cross the overweight category. Plenty of fresh fruits, vegetables, dietary modifications, avoid excessive carbohydrate dense food, avoid excessive spicy fatty foods, incorporate more of fresh produce, green leafy vegetables, fruits, make your plate colorful, and physical exercise. Physical exercise, even if it doesn't reflect in a reduction in weight loss, it does improve the way your body handles sugar load, carbohydrate load, the insulin levels, and its mechanisms, the actions, they all get affected in a positive way. So the hormone disturbance which we see in anovulatory ladies, especially PCOS, obese patients, and where there is an issue of ovulation, definitely even before the visible change in the weight, they do help in normalizing the hormonal functions. So hard work never will let you down. It will always physical exercise, 30 minutes a day, at least 3 hours in a week. Again, not strenuous or very hard or harsh, high intensity workout, but be gentle, slow, and steady. Um, Good meditation or mindfulness or deep breathing techniques. These will all reduce the stress at the cellular level also. So these will all try to improve the quality of egg, and definitely they will improve your chances of ovulation and a good quality egg and a good quality embryo. So these are the important tips for the women. So I will also those with pre-existing medical diseases like hypertension, thyroid, and hyperprolactinemia. Then there is diabetes. So both the men and the women need to get their conditions checked by a physician and take the corrective medications because diabetes, hypertension also affects the quality of semen, quality of the sperm, and also the performance they may be having. It may contribute to premature ejaculations or erectile dysfunctions. Also, in the women, they have to be physically fit to continue the pregnancy because once the pregnancy happens, immediately they will be continuing in the pregnancy. So, medical things need to be put in order before we plan the fertility treatments. So, to sum up, um, how do we improve the success rates in IUI? So, first will be reduce stress and anxiety levels so that the performance can improve both for the man and the woman. Maintain your body weights towards a more healthier flag post. At least try to be keep your BMI under 35 and no treatments if the BMI is more than 35. Try to keep it less than 29. So address the weight issues. Overweight is okay, but obese, try to come down, reduce your weight. Incorporate good dietary changes so that you take a good nutritious diet. Health supplements like folic acid, vitamin C, E, antioxidants as prescribed by the oncologist or your gynecologist you should be taking to improve the quality of eggs. Put your house in order, that is, treat all your medical ailments like hypertension, diabetes, thyroid disorders, prolactin, hyperprolactin, all these things. Please ensure that they are all well controlled before you start your fertility treatments. Next, don't miss your doctor appointments because timing is the most crucial thing here, which contributes very highly to the success of IUI. So do not miss your scans after the follicle, especially when the follicle reaches 17 mm. Though you will be on daily, please keep up your appointments and go for the scans, and so that you don't miss the ovulation time. Continue being together alternate days once the follicle crosses 14 mm, the least I'd say. And If the semen analysis shows the numbers are little less, you can also go choose opt for the semen freezing option, so that sometimes we can add up the numbers. And any local infection, genital infections, and all need to be addressed before we start the IUI treatments. And since the chances of success with the IUI, it usually is in the range of 15 to 20 cycles. At least you need to go for 2 or 3 cycles of IUI. Once the cycle, the positive rates, they peak by the third cycle, and after that there is no increase in the success rate. So if you have tried 3 cycles of IUI and if you didn't have any success with it, better to go for a more definitive treatments like IVF or the needful. So friends, I hope I have tried to convince you of the things you need to do to increase the chances of success in IUI. So, any questions? Uh, we'll take those. So, Arman Deep asked how many attempts are successful in IUI. So, just as we have discussed, success rate of IUI is 15 to 20%. That is also in the younger groups, at least the women 35 years and less. So, we can try to improve the success rate by repeating the treatment by 3 cycles. But the studies have shown that more than 3 cycles, the success rate is not increasing. There is a drastic fall from the fourth cycle onwards. So we feel that 3 cycles is a good number. If we are not getting successful by the third time, I think you should be planning to move ahead towards more definitive treatments like IV. Is there any benefit of doing a double IUI? So double IUI, as I have stressed before also, if the couple is able to have a regular intercourse, double IUI may not increase the success rate. But yes, when they are not able to have regular physical intercourse, or uh, when there are problems with erectile dysfunctions or premature ejaculations, there are issues like that, or when you are going for a donor sperm IUI, you can attempt a double IUI. It may increase, but it is not necessarily for everyone. So minimum 3 cycles you can try to for getting a positive result after IUI, but if not by the third cycle, definitely I suggest you should go and try for a definitive treatment after the third cycle. No, IUI is not painful. If you are able to undergo regular scans, vaginal scans, there should not be any. It's not a painful procedure. If you are used to having scans done, you should be able to undergo the procedure without any difficulty. Fertility supplements, as in those antioxidants, vitamin C, E supplements, folic acid supplements, definitely they improve the quality of eggs, they improve the quality of sperm, especially the antioxidants, they reduce the stress levels at the cellular level, and they improve the quality of the sperm. So kindly take the fertility supplements which are prescribed by your fertility consultant or your andrologist. Of course, these supplements, they do take time for the result to be visible, but definitely they do help us. So it is always advisable to take them as prescribed. Uh, is intrauterine insemination a good treatment? So, as we have discussed in the beginning of the this class, I mean this discussion, but IUI does not have any effect on the way the egg is getting fertilized by the sperm, and also the implantation, how the fertilized egg is getting implanted, the embryo implants inside the uterus. What IUI is doing is that it is just ensuring that at the time of ovulation, good enough number of motile sperms are available inside the uterus, and thereby inside the tube. That is it. So we are just ensuring good timing and good numbers. So to start with, it is a good treatment, but it will not help in those patients who have got dual factors of infertility. When the tube is not working, it is not going to help them. It also won't help in those conditions, the male factors, when the semen numbers are very, very less, or the quality of the sperm is very bad and motility issues are there. So in this condition also, it cannot help. Where it can help is when there are only mild problems with the semen parameters are just mildly delayed, just little. So only there it can help. It can help those patients who are having ejaculatory dysfunction or erectile dysfunction. They are not able to conduct regular sexual intercourse. Or in those patients, say the unexplained infertility, where the couple have been evaluated, but no other uh, problem is seen either in the tube or the uterus or anywhere else. So for them to start the treatments, IUI is a good option. So also is the case in case of mild endometriosis. In such cases also we can start IUIs, especially when combined with the gonadotropins, where we are also using drugs for ovulation induction when we are combining. Yes, it is a good starting treatment for these patients with mild problems. But it is not the solution for all the problems. You have to choose and select your patients judiciously. So after the insemination, you do a pregnancy test after 2 weeks, and check urine pregnancy test, or you can get your beta HCG done, and you will know whether you are pregnant or not. So for any other further queries, you can call on this number 7825850116 and seek help, guidance from the Oasis Fertility Helpline. Thank you all for being with us. Have a good day.